that could definitely prevent you from having the natural birth that some women desire. You can definitely have a natural birth with having fibroids if those fibroids are not obstructing the birth canal. The baby in a natural birth comes through the vagina. So if you have a fibroid in the lower uterine segment or near the vagina, close to the cervix, then that can lead to an obstruction. Sometimes fibroids can also lead to a baby not turning. And so usually doctors aren't as comfortable with a breech presentation, meaning that the head is at the top of the uterus or at the side of the uterus and not towards the vagina. So breech presentation would likely lead to a C-section if your doctor isn't comfortable performing it. And if the fibroid is in a place where likely the cervix isn't going to dilate or it's going to obstruct the path of the baby, that could definitely prevent you from having the natural birth that some women desire.
Having fibroids, unfortunately, overall will increase your risk of needing a cesarean section for a number of reasons. They could not even be in the birthing canal, but not allow you to dilate well. My best friend had a 1 centimeter fibroid prior to pregnancy because I ultrasounded her and I found that 1 centimeter fibroid, and it grew to 10 centimeters by her second trimester, and she labored for 4 days before she ended up with a cesarean section. She just would not dilate. And then another question that we commonly get asked is, oh, can't y'all just take them fibroids out when you do my C-section? No, ma'am.
No.
No, ma'am.
Heck no.
No, ma'am. Did we not talk about how much these fibroids bleed? So that is a concern.
It's
very important because it makes sense. It sounds like it should be something that can be done, but unfortunately your body is preparing. God is wonderful in the way that he has made us and prepared us for pregnancy. We have a ridiculous amount of blood flow going to our uterus when we're pregnant, because if we lose a liter of blood, we can still compensate and be wonderful and do great after delivering a baby. But all of that blood flow is also feeding those fibroids at that time. So if we were to do a myomectomy, which is the removal of fibroids at the time of the cesarean section, there is a risk that you could hemorrhage and bleed significantly. So we usually will leave them in place if they're not in the way of getting the baby out.